was initiated. Where are we?
I'm here with Bridget Reeves, part of the Gosport family. And Bridget, can you tell me why you're here today?
My grandmother died at Gosport Memorial in 1999, and we've campaigned relentlessly for 20 years for there to be criminal proceedings against the doctors and nurses who administered the overdose to my grandmother that caused her death.
Well, it seems like a reasonable request to get an investigation into all of this.
You would think so, but we've been through literally every government body in Quango who have simply locked themselves together to deny, defend, diffuse, which is, unfortunately, if you've ever been through the NHS complaints procedure, you soon learn that is the tactic they play in the hope that you'll just go away.
There were concerns raised by some NHS staff early on.
Yeah.
Can you tell me a bit about that?
Yeah, so when Dr. Jane Barton joined the hospital in 1989, the nurses immediately raised concerns about the introduction of the syringe drivers and these opioids, and said that patients previous to that just weren't dying in this hospital, and now night staff were coming in to find patients who had previously been happily sitting in bed the day before, and now they were comatose, and the next day they were dead. There were meetings, and we know the minutes of those meetings were later given to the police to form part of their investigations, where the nurses clearly said, we're not comfortable. We've been told by the doctor and by other senior nursing staff who were also practicing this sort of, I don't know what you would call it, genocide, and it continued. The trust basically said to the nurses, you just don't, you don't understand what you're doing. You just need further training, and they were just closed down. The culture of killings at Gosport just continued to grow, and we see that in the CHI report, because the administrations of diamorphine absolutely came to their peak into the 90s, where I think these the nurses and doctors who were involved just knew that they were going to be able to get away with it, and for whatever their intent was, hundreds and hundreds of patients have now been identified as being overdosed, and it's caused their death.
It's quite a shocking state of affairs that people were given massive doses of painkillers. Sometimes they didn't even need any pain relief, and when staff raised it, they were ignored. Did they suffer any other harm, the staff, I mean?
Well, there was a lady who was brought in 2002 to do a bullying, a sort of anti-bullying, if you like, kind of assessment on the hospital. One of the senior nurses who was a leader in this regime, Jill Hamlin, she was accused of bullying other nursing staff who perhaps even at that stage were still trying to stop treating the elderly in the way that they were. So this lady was brought in, and she was horrified, because rather than just coming in and hearing about bullying in the workplace, she came in and started hearing about what she considered to be mass murder. All we have now is the report that this lady actually wrote, which she's passed a special crime, which hasn't actually formed part of the panel's report either, so it's quite remarkable, as it is a very damning piece of evidence.
Other NHS-related scandals in Mid-Staffordshire, in Southern Health, and now Gosport, there seems to be a pattern of senior NHS leaders burying their heads in the sand and in some cases actively covering up. What does that tell you about the culture in the NHS?
Well, I think there is a cover-up culture. I think if you complain about the NHS, you're damned, because the NHS is a national treasure. For me, I just want to make it clear that I'm not here to damn the NHS. My father had a bone marrow transplant on the NHS at the same time that my grandmother was murdered at Gosport. We're here because when things go wrong and people speak out, it is for these senior members of staff to listen, to hear, and to make change, not to actually then put people on this horrendous roundabout, which is 20 years for us, and not actually make that difference for what is, something that's very, very important for patient safety.
I'm a campaigner for the NHS. I'm trying to raise awareness about privatisation, and the last thing I want to do is harm the NHS. But if we don't openly look at and find the truth, this will harm the reputation of the NHS far more than covering up.
Absolutely. If we can't get justice for the victims of Gosport, I don't know where we go. But this is beyond the senior staff at the even within the trust itself. That the coroner in our case, who was Coroner Bradley, openly was in discussions with NHS lawyers and other senior NHS staff discussing how he was going to limit the evidence in the inquest for my grandmother's death to ensure that the jury didn't have all of the facts. And the response from the NHS lawyers was, well, this is great, because otherwise it would be an NHS PR disaster. It's really shocking that you can have murder under the umbrella of the NHS, but all that really matters is the public relations.
Some of the research that I've done shows that leaders who have effectively covered up scandals have been promoted within the NHS, so there is a toxic culture at the top. Have you managed to secure some backing and political backing in your campaign?
So I think people come in and out of, when you're on a journey as long as this, and I think you'll see on one of the placards here today just how many health ministers have actually been part of this scandal, that I have very little faith in our government and the people that come in and out to stand with us. Most importantly is for Theresa May and for Matt Hancock to actually grant the families a meeting and listen to what we've got to say. We've been dumped with the panel's report. It should have been a public inquiry so that the public actually could see the evidence. There should have been a criminal investigation, not a years of police assessment, which potentially 3 of those 4 outcomes do not give any remedy to the family. There's only one of the outcomes is them actually beginning a criminal investigation. Is absolutely preposterous. It's reprehensible. It is absolutely devastating for us, the families.
What has it done to your trust in how the British system works?
Well, I think unless you get caught up in something like this, you would never believe that there could be that much corruption. The fact that we've had 12 inquiries, there's been no transparency, no justice, and it's gone right to the top. The CMO, Liam Donaldson, locked the Baker report down for 11 years, denying the families justice even at that time, even though he had released it to the GMC, and therefore they had then in turn released it to Jane Barton, the very lady who in my mind should be standing in the dock right now answering why she deemed overdosing patients to death was good care.
Well, I hope you all the best in your continued fight, and I'll do what I can to support you. Thank you very much for talking to us.
Thank you very much, Doctor.